happen to just love Well and the way that it provides for our patients and for our clinics.
This was something we really knew was needed, a way to reach out to patients in a new way, in a faster way.
It's a great feeling for them that they can stay in contact with our office and they can have access to the doctor's office. Touch of a finger.
We are a messaging application. It sits on your computer, it's hooked up to your phone, and it lets you text people. Now, what's novel about Well is that it's been designed for healthcare. If I'm communicating with everybody else in my life over messaging, that should be the norm in healthcare. I saw that opportunity, but I really didn't know anything about healthcare. And that's actually how I met my co-founder, Joe Tischler. And he was the CIO of one of the largest outpatient radiology clinics. And he basically told me, look, working at a call center, you're making calls all day, people are angry because they can't get a hold of you. That's not fun. The patient experience can be so much better, not only for the patient, but for the folks on the other end too.
The Spine Center is a very busy place. We see approximately 3,000 patients each month. So with that, there's a lot of appointments that get made. The biggest problem that Well has solved for the Spine Center is missed phone calls and telephone tag.
At Cedars-Sinai Medical Group ENT, we see around 100 patients a day. So once Well started, we no longer had to make those 100 phone calls, which freed up a lot of our patient service reps' time.
There would be calls that lasted anywhere between 15 minutes to 29, 30 minutes. Same time, other calls are coming in.
You're taken back into the office. Again, you're done with your visit, you come and you check out. And now it's more of a personal interaction. You're able to have that small, meaningful conversation from the time that they walk in and also on the time that they leave, because they're like, oh yeah, you guys are gonna text me.
Now that I have Well, I can multitask. I can keep in constant communication with the patient. It's all done now within a minute and I'm well.
When we first applied to the Accelerator, we had a really big hunch that what we were doing was gonna work. And we wanted to prove that rapidly at a very large scale. We had one customer. Our customer was in orthopedics. Our reach in healthcare was 0.0001%. So immediately going into the Accelerator, it was exposure to every specialty under the sun. Over the course of 3 months, we got experience that would have taken us 3-4 years in the marketplace.
Well comes into our conversation now regularly. So when we're trying to figure out how to do something new, we think about, well, what about Well? Can Well do that? Can Well do that questionnaire? Can Well send that form out?
Some of the statistics are impressive. Thus far in our work with Well, we've seen over 100,000 text messages backwards and forwards between the faculty practice and the patients and or their family. With the implementation of Well, a 17% reduction in the amount of no-shows and or cancellations associated with the practice.
I think the physicians have a more efficient schedule. Just their day goes smoother because they don't have those no-shows.
I had a meeting with one of our oncology groups, and we're just beginning to advance some of their technology. And one of the first things they asked for was the Well technology, because they had heard about how it was creating communication channels that were much better than they've had before.
Looking back, there's no way we'd be where we are today if it weren't for the program. I think when Joe and I look at our projections on where we wanted to be, we're definitely beyond where we thought we could be at this time. Our vision is to make going to the doctor as easy as meeting up with a friend. In terms of how we get there, I think today we have our sights set on getting our messaging client on every terminal at every healthcare practice in America.
I do love Well, and it just makes me happy knowing that our patients love it just as much as I do.
I love Well. It's been great for Cedars-Sinai and the Spine Center.
I think Well has brought great value to both the medical center and the healthcare delivery network.
So Guy and Joe, we're really, really proud of you. We're happy for you, and we thank you for what you've done to help improve our experience. And I think just as much so the experience for our practices, our faculty, physicians, our staff, because it has created a different way for us to engage them and them to engage us. So we wish you nothing but the best of luck.